Hi, welcome to Civic Buzz, a program of the League of Women Voters Minneapolis. I'm Ellen Dan Iwarden, Program Director for the League, and I'll be moderating the program tonight. The League is a nonpartisan political organization that encourages informed and active participation at all levels of government, works to increase understanding of major policy issues, and influences public policy through education and advocacy. I'm thrilled to be helping the League with this work and encourage you, if you're not already a member, to join us. You can find out more at lwvmpls.org. Before I introduce our speakers tonight, I'd like to introduce the president of the League of Women Voters Minneapolis, Colleen Moriarty, who will say a few words. Colleen?
Thank you, Ellen. Well, Ellen was so kind tonight to offer me the opportunity to be with you and to express the gratitude of everyone at the League of Women Voters, to all of our members and to all of the people that we worked with on the election. I think that we were really pleased with the outcome on the question 1, because that was something that we had looked at for years and had come forward and supported as an organization. So obviously, we're very excited to see what the outcome of that will be. In addition to that, and I know Marilyn, I saw Marilyn was on this call, the hours and hours of dedication, of holding forums, of helping to collect ballots, of helping the city of Minneapolis process those, and the hours of promoting voting within our community is just immeasurable. When people really look to the League of Women Voters, they look to an organization that has an integrity. And I can assure you that we are maintaining that reputation as we move forward. So thank you very much for everything you did. I so appreciate it. I know the board does too. And the whole organization is to be congratulated. Thanks very much.
Thank you, Colleen. Tonight, I'm honored to present Danielle Werder and Ginny Gelms, who will speak to us about homelessness. Danielle is the area manager of the Hennepin County Office to End Homelessness. She started at Hennepin County 6 years ago as the systems planner for the single adult homeless response system. Danielle led the efforts to end chronic homelessness, as well as the Hotels to Housing project, which has resulted in 370 people to date being housed from the high-risk protective hotel sites, which were established as a response to COVID-19. Ginny has served as the Hennepin County Elections Manager since 2013. She previously served as the City of Minneapolis Interim Elections Director and in the Johnson County, Iowa Elections Division. She holds a graduate certificate in election administration from the University of Minnesota Humphrey School of Public Affairs. Tonight, we are in a Zoom meeting, so at the end of their presentations, we'll be able to ask them questions directly. And I hope you will hold your questions until the end tonight. So Danielle, take it away.
Thank you so much. Hi, everybody. It's good to be here. I'm going to quick share my screen. Let's see if I can do this seamlessly. Can you see it? Yep. Okay. So thank you for that introduction. I am Danielle Werder. I work at Hennepin County, and I'm the manager of the Office to End Homelessness. Just to kind of give you a sense of Office to End Homelessness is within the housing stability area of Hennepin County, which is in the Health and Human Services Department of Hennepin County. And we aim to make homelessness rare, brief, and non-recurring. So let's see here. Let's see if I can get to the next slide. Oh, there we go. All right. So housing affordability disproportionately impacts households with the lowest income. The majority of people who are cost burdened are in the extremely low income bracket of earning 30% or below of the area median income. So you can kind of see how it breaks down. Overlay that with who's experiencing homelessness in Hennepin County. So as you can see, there's a severe racial disparity within the homelessness population. This is due to a multitude of factors, and that is a whole other talk. And we really can't end homelessness or even get close to it without acknowledging that there is this severe disparity and working diligently daily to try and address it and explicitly calling it out. So that's why we have it at the front of all of our slides. So I kind of shared where our office sits within the county, but what is our county's role within the housing ecosystem? So, oh, nope, I am not, there you go. Now you can see who experiences homelessness in Hennepin County. My slides were behind my talking points. So in poverty, you can see, I don't know how big this is on your screen, but Native American and African Americans are completely disproportionately represented in unsheltered homelessness, specifically Native Americans, and homelessness in general. Our county role in the housing ecosystem. So as you can see, there are many different entities working on the different components of creating and maintaining affordable housing. The key is coordination and having each piece of the puzzle be doing their part to ensure there is fair and consistent housing access for all who need it. And obviously, we still have a lot of work to do to reach that goal. The county tries to do our part by working very closely with city and state agencies, as well as the public housing authorities, who are vital partners in this work. So what is our current impact? So we have 1,100 units of affordable housing created or preserved annually since 2010. We had a 10-year plan to end homelessness several years ago. It ended. We obviously didn't meet that goal. However, this goal of preserving and creating this many units per year was set way back then, and we've been able to continue that sustainably. Help 23,000 households a year access and maintain stable, affordable housing through supportive housing services, subsidies, and other programs, and maintain nearly 800 single adult shelter beds and as many as 150 family rooms, which shelter around 9,000 people experiencing homelessness every year. All right. So, with all of that, how do we focus our impact? So we're focusing our impact on extremely low income individuals. So those are folks that are entering homelessness or exiting homelessness, but doing so using subsidies and resources that are meant for people experiencing homelessness in order to exit homelessness. So it's deeply affordable and supportive housing and assistance, which we need more of. And then there's, of course, there's affordable housing, workforce rental housing, and affordable home ownership. But what we're really focusing on is this piece. So, all right. So homelessness, when you really boil it down to the simplest thing, is really about inflow and outflow, because there's not a static group of people experiencing homelessness. People come in for one night of shelter and never return. There are people who return episodically for years. There are people who get stuck and stay for months or years. And then there are people who are exiting homelessness each day and going into market rate housing and public housing and our homeless dedicated unit. So it's just this constant inflow and outflow, and it's not a static group of people as many kind of picture. So the goal is always for outflow to exceed inflow, and that's how we actually end homelessness. Okay, so what is shelter? It's important to know what shelter is not and what it is, and what housing is not and what it is. So shelter is a place to be during an emergency. It should be easy to access during a housing emergency, available for the duration of that emergency, and focus on ending that emergency as quickly as possible. Shelter is not housing, and it should not be a place for people with no or low income to live, or a waiting room for subsidized housing, because these are human beings that deserve housing, and they don't deserve to wait for it until we can create it, and or live in congregate spaces that were never meant to be homes. Okay, so strategies to grow our impact. So again, if we're looking at inflow and outflow, there's all these different strategies in order to do that and be targeted and coordinated and also incredibly data informed. So shelter diversion, I'll get into some of this in just a bit, so I'll get into more specifics, but shelter diversion and lowering barriers in shelter and improving outcomes of shelters, which means housing outcomes. Then what we can do is we can work to learn what those folks need and create project-based subsidies, supportive housing strategies. And one of those strategies is creating single room occupancy. So just really low income housing without services, which is really going to fill a gap in our housing inventory. Okay. All right. So we need tactics to grow our impact if we want to grow our impact. So minimize people entering homelessness. So emergency renter assistance, and I'll get into that, but that's very key. We need to be able to keep people in their homes. It's much easier to keep people in housing than it is to find housing for them and get them back into housing. Diversion case management and financial assistance, and again, I'll explain what that is in a second. Renter navigation, so that it's not just all on the renter to figure out all the ins and outs, and legal supports for renters so that they know they're right and are again able to maintain housing when they can. So then we need to maximize the people exiting homelessness with the outflow. So the family self-pay and eligibility criteria, we know consistently we hear about family shelter and needing to look at that. So that's what we're going to do. 24/7 shelter. We need to know where people are. We need to be able to find them. They need to be able to sleep and do what they need to do in order to move themselves out of shelter. Shelter case management services in shelter. And these all may sound like obvious things, but these are things that we have not had in our community for ever, really. These are new things. Project-based subsidies, supportive housing strategies, single room occupancy, and enhanced digital platforms. All right, so growing our impact around homelessness specifically. And I'll talk about housing in a moment as well. So emergency renter assistance. First, in terms of growing our impact, the pandemic brought so much hardship and change in our community, and it also brought funding and support for our under-resourced homeless response system in a way that we have never seen before, and is pretty transformative. Between the Emergency Rental Assistance, Coronavirus Aid Relief, and Economic Security Act, which is the CARES Act, and the American Rescue Plan, which is ARPA Act funding, we have been able to utilize our existing vision and goals to implement programming and funding that we believe help us do that. The thing of decreasing inflow and increasing outflow, knowing that we have a long road ahead of us still. So our renter assistance, in each of these slides, you'll see on the bottom that there's an impact of disparities. Again, we center that in all of our work. So if we're going to fund something, we need to believe that it's going to help move the dial on that goal. So emergency rental assistance, again, is on the upstream side of things. We're trying to prevent homelessness. We're trying to keep people in their housing, and it's flexible funds and navigators. And the legal representation in housing court, I want to call out because we're prior to the pandemic, we know that most people didn't know how to get legal representation and didn't have it, and that you're much more likely to stay in your home or beat the eviction if you do have it. So universal legal representation at housing court is a really big piece of this, and we hope it has some pretty big impacts. Shelter diversion, I told you I'd come back to it. So shelter diversion, if you think of homelessness as a highway, prevention is the first off-ramp, and then diversion is the second off-ramp. So if somebody says, I need shelter, it's having creative conversations around, is there anywhere else that you want to go, that you can go, that we can help get you? Because once you get into shelter, it is very hard to get out. And it's also sometimes a very traumatizing experience, no matter how great we try to make our shelters. So if we can divert someone from shelter, we want to do that. And this is a new service that we've been able to infuse into our system simply because of this new funding that's come online. So we always want to lower barriers in shelter. And so what that means in this specific situation is eliminating self-pay for shelter, both in singles and family shelter. And as you can see, it's kind of been a long time coming, and we believe it's going to help families of color. Improving outcomes 24/7. I had mentioned that we need to know where people are, and that it's kind of obvious that we should have 24-hour shelter. The single adult shelter system had never had 24-hour shelter prior to this funding coming online. People had to leave during the day, and it was really hard to meet with case managers or healthcare or fill out applications or work the third shift. And so we've seen that 24/7 shelter is a much better way to engage with people, to have people be in a place where they can engage and begin to be housing focused. Case management. So this is one we're really excited about and really proud of. As you can see, we hope to house 1,000 people each year. This is a new team, just launched. They're in the Office on Homelessness under me, and they just started taking referrals on the 1st, so it's brand new. It's a homeless to housing program, and it's essentially putting trained, thoughtful social workers out on the street to work with people to get them into housing. And we'll have a team that works on the upstream side, so really looking for folks that have been homeless for less than a year, and folks that are more stuck in shelter. And so we're really excited to see the impacts of this. We're just getting started, and we're measuring everything, and we're going to study everything. But we're hoping it's an influx of housing outcomes that our system desperately needs. We also have employment services that are going to be connected to those case managers. So really intensive employment programming for folks that just need to increase income or increase their skill sets and be able to have a program to tap into and to help them on that journey, and directly relating to housing. So it's an exciting partnership between two different departments within Hennepin County. All right, low barrier shelters. So some of you may have heard about Avivo Village or AICDC Homeward Bound, American Indian Development Corporation Homeward Bound Shelter. Those are two new shelters that we were again able to bring online with this new funding in response to the pandemic. It's acknowledging that there were folks that were outside that were not coming inside because of the shelter options that they had. And so Avivo is a different model. They have their own spaces. It's even more low barrier than our otherwise low barrier shelters in terms of allowing pets and other things like that. And then AICDC Homeward Bound is a culturally specific shelter serving Native Americans, staffed by Native Americans, and it's again allowed an entire population that didn't feel comfortable accessing our mainstream shelter to come inside. 50 beds at the Homeward Bound shelter and 100 at Avivo. All right. So growing our impact in housing, and I'll speed through this part, but we have to do housing too, right? We can't just have really good shelter. We need people to move out and go into housing, and we need a plethora of options and a spectrum of options for folks. So project-based subsidies further lower rent rates in county-funded capital projects and create more units at or below 30% AMI, which is going back to that first slide, and project-based vouchers, which is basically just on top of the building, making it more affordable using these subsidies. And 1,000 units is nothing to sneeze at. The supportive housing strategy. This is, and honestly, an entire presentation in and of itself. So this is being managed by our Housing and Economic Development Office within Hennepin County. And this is just a really exciting shift in how we do affordable housing. Instead of being the last one in, we're going to be the first one in, and have priorities based on data that we know that this is the gap in affordable housing and this is how we want to fill it. We've already started putting chronic units, or starting to put for chronically homeless individuals who are homeless for a very long time. So having dedicated housing for them, built for them, and that we helped fund and created programs that we really believe is going to move the dial. So as you can see, we hope to put 1,000 of these units on or more online by 2030. So it's a long-term plan. Single room occupancy, again, I mentioned this, is really just to create spaces that are deeply affordable. We've seen a disappearance of single room occupancies that have naturally occurred in our communities. So now we need to be really intentional and put them back. And so using CARES funding, we actually purchased a building, and it's now called Stevens Square. And it's the old VOA property, and Alliance Housing runs it, and it's $375 per month, and shared kitchen and bathroom facilities, but incredibly low barrier. They're not screening out people for backgrounds. They're not screening out people for immigration issues. And it's really creating rental backgrounds for folks. And it's 32 people who otherwise just had no option of moving in have now moved in, and it's really just exciting. We've purchased a couple of other buildings that have been used as protective hotel sites, the hotel to housing program that Ellen had mentioned. And we hope that those, once they're no longer protective shelters, will also be able to be transitioned into this type of affordable housing. And that's all the talking I have for you all. And so I can pass it on. Unless there's questions. And I don't know if you want to do this at the end.
Yeah, let's wait and do those at the end.
Okay.
And just for everybody who's entered, I've been muting you as you come in. And if you wouldn't mind staying muted until we have the question and answer after Ginny's presentation. Thanks. So Ginny.
Thank you. I'm going to share my screen here. And can you all see me and see my screen? Yes? Okay, great. Yeah, good evening. So I'm Ginny Gelms. I'm the Hennepin County Elections Manager, and I'm just going to kind of supplement a bit about what Danielle was talking about in terms of the impact of experiencing homelessness on voting activity, and kind of what we do at Hennepin County Elections to address that gap for our voters. So, I'm just going to briefly talk about how someone can go about voting without a permanent address. I'm going to talk about how you all can help your neighbors that might be experiencing homelessness to vote. And I'm going to talk a little bit about our program that we have at Hennepin County Elections that addresses barriers around this for people who are unhoused. So voting without a permanent address, I mean, well, actually, before I even go there, I just want to mention that it's important to us at Hennepin County Elections that we focus on this particular barrier to voting activity, because voting and elections, voting registration, it's based on address. So, there's already baked into voting activity a barrier for folks who do not have a permanent address. The address is what we use to determine where you have the right to vote, what races you can vote on. So it's kind of it's a very upstream kind of barrier that takes some special focus from us. So it's a surprise to some people that if you don't have a permanent address, you may still, that does not bear on your eligibility to vote. The eligibility criteria in order to vote are to be a US citizen. You have to be at least 18 on election day. If you can register when you're 17, as long as you will be 18 on election day. You have to be a Minnesota resident for at least 20 days prior to election day, and you have to have completed all parts of your felony sentence. So folks who are in jail are still able to vote as long as they're eligible. They're not currently serving a felony sentence. I'm hoping that a lot of these criteria are probably review for people at the league, but just always good to go over it. Nowhere in there does it say that you have to have a permanent address in order to be eligible to vote, but it is harder for folks who do not have a permanent address to register. Can be really difficult to navigate for unhoused voters. So then the first question that comes up is, okay, you know, where am I supposed to register if I don't have a permanent home? Well, there's a statute around what counts as your residence for voting purposes. But the easiest kind of shorthand that we use is you basically where you sleep at night. That's where you register to vote. And if you're somebody where where you sleep changes, then we advise that the voter registers where they expect to be sleeping the night before their voting activity or the night before the election. There is, you know, a whole process for folks to pre-register to vote, but many unhoused voters are going to be registering at the time that they're voting with an election day registration process rather than pre-registering to vote. And one option that is not well known is that unsheltered voters can register at an address description. So here's an example of what that would look like on the Minnesota voter registration application. That box number 4 is where you put where typically you would put an address, but if you don't have an address, you can describe where you live. And the key here is that we want the description to be as specific as possible. And for the reason for that is we need to be able to precinct the voter correctly and determine kind of where they're sleeping, what precinct is that in. So this is a good example of this describing a corner of Loring Park, and then also gives the nearest cross streets so that we can precinct that voter. Now, for voters who do not have their address cannot be confirmed, we have this whole process at the elections office where when somebody registers to vote, we send out a what's called a postal verification card. This is all provided for in statute. It's non-forwardable, goes to the post office. The idea is that if it doesn't get delivered to if it comes back from the post office as undeliverable to the voter at the address, then that maybe is a piece of evidence that the voter doesn't live where they say they do. Well, for voters who don't have a permanent address, we know that that's going to happen. So their address isn't going to be able to be confirmed that way. But folks can still vote even if they do have this roster challenge. And what it means to say a roster challenge, it means that when they show up to the polling place, there will be the words next to their name on the roster will say challenge. And so the election judge, when they're checking that voter in, will see that. And there's a whole process that the election judge has to administer the challenge process. We actually have challenges for any number of eligibility possible reasons. This is one of them. It can be an intimidating experience for a voter to show up and have to go through this extra process, but the extra process is there to be able to ensure that people who are indeed eligible can still vote, even if they weren't able to go through the kind of typical process. So what happens is that the election judge will put the voter under oath, and then the voter will basically swear that, yeah, I live here, I live in this precinct. And then as long as they are able to swear to that, they are allowed to then continue on and vote. So the most common way for a voter to register on election day, a voter who is experiencing homelessness, is to use this vouching process that we have in Minnesota. Typically for election day registration, a lot of folks, you need to provide proof of your identity and your residency when you register to vote on election day in Minnesota. So most voters who are doing election day registration do this by bringing in their driver's license or state ID that has their current address on it, or an expired address along with a utility bill. These kinds of documents are often not accessible to people who are unhoused. So typically what they're going to use often is this vouching process. Now, a voucher is somebody who is a resident of the precinct where the voter is trying to vote and is themselves registered to vote or can become registered to vote that day using their own documents. And then they turn around and they swear an oath. I know this person. I personally know this person lives in the precinct, and I'm vouching for them. So this is something that any voter can do if they are themselves registered in that precinct for somebody that they personally know lives in the precinct as well. It's also an option for residential facility staff. The difference here is that a kind of a regular voter, there's a limit of, you can only vouch for up to 8 other voters if you are vouching. But if you are a shelter staff, residential facility staff person, then you can vouch for as many people as are in the shelter or the facility where you work. So those are some good options that that we help with voters who are unhoused. A couple of other examples are, you know, if somebody is couch hopping, or maybe they're living out of their car, but they're parked at their friend's house or their family's house. That friend or family member, or the person that they're staying on the couch, that person might be a good option to be a voucher for this voter. Or say a neighbor who is familiar with folks living in a nearby encampment can also go be a voucher for people. Again, the main point there is that the voucher is themselves registered or can register using documents and has personal knowledge that the person they're vouching for does live in the precinct. So that goes a little bit into how you can help your neighbors to vote, particularly your neighbors who may be unhoused, having conversations with people. So maybe, you know, the first thing to approach is, hey, have you heard that there's an election coming up? I'm assuming these kinds of conversations are particularly the kind, you know, probably things that members of the league are used to having, kind of conversations that you've had before. But, you know, having a conversation like this with somebody who's experiencing homelessness maybe is a little bit different. Folks who are going through that, often, you know, voting activity is not going to be their primary, you know, concern. They've got other things going on. So making them aware there's an election coming up, confirming that they're eligible. Again, there's a lot of misconceptions around, you know, you have to have a house, you have to, you know, have an apartment or something to be able to vote, and that's not true. But, you know, there are these other eligibility criteria, and then asking them, you know, what they might need in order to be able to vote. Can you serve as a voucher for that person to help them register? Can you serve as a witness for that person on their absentee ballot, and maybe talking through the different ways to vote with that person? Mail-in absentee, if the person has a way to receive mail, a post office box or a friend's house or something like that. In-person absentee is a good option, as well as election day. So talking to folks and helping them create their voting plan can be really helpful, especially helping your neighbor to envision when will they vote, who or what are they going to need to bring with them in order to vote, and how are they going to get transportation? Can you offer transportation to this person to go where they need to go in order to get the ballot or go to the polling place? So as I said, there are lots of ways to vote. Direct balloting is an option the week before the election. That's where you can actually go to an in-person absentee voting location and put your ballot directly into a ballot counter. Prior to the last week before the election, it goes into a series of envelopes that will later be opened. Polling places on election day, of course, as you well know, are open from 7 a.m. to 8 p.m. And so that's a little bit about helping your neighbors to vote. And now just, let's see, very quickly, I will talk a little bit about what Hennepin County Elections is doing around homelessness and voting. We have a Voting While Homeless work group that we started in 2018. This is a group that is it's a consortium of election administrators, shelter staff, other community partners and service providers, and also people with lived experience around homelessness. The purpose of this is to try to brainstorm and identify different barriers and reduce those barriers to voting for people without a permanent address, and to hopefully address policies that we might have on the county level that we can actually change without any law changes, but also surface those laws that we might be able to advocate for changing to increase accessibility to the ballot. This group meets several times a year, and it's been helping us to build strong partnerships and inform our policy decisions, as well as informing how we approach outreach and engagement with our voters. So our outreach strategies include increasing the pool of trusted messengers, so providing some training to shelter staff and caseworkers around basic elections information so that they're armed with that. They can help serve the folks that they're already working with. Having election staff serve as navigators, going to drop-in centers, going to shelters, because the experience of homelessness is so broad. It's a broad spectrum. Oftentimes a solution might need some creative and deep knowledge of the different tools available to complete the voting process. So that's what we hope to achieve with that navigator role. And then increasing institutional support, so working with shelters and organizations to help them create election day plans and outreach plans for the folks that they are serving. That was a big part of our work in 2020 with the pandemic, working with the temporary hotel shelters to create strategies around absentee voting, because we really wanted to keep as many people out of the polling places as possible during that really heavy part of the pandemic. And again, I just mentioned that all of these strategies, you might notice, are a lot more effective with people who do have connection to shelter. It's a really tough issue for us to try to reach people who are unsheltered. And we don't have a lot of good strategies for that right now. So we do work with community partners. In 2020, we began actually creating contracts for community organizations to do this kind of work with their own communities. And we've contracted with various organizations that work with homeless populations, including the ones listed on the slide here. And so this is the kind of high level of what we have done at Hennepin County Elections around homelessness and voting. And here's my slide for questions and answers. And I think it's a good time for, if you have a question for me or for Danielle, happy to answer that.
Wonderful. Thank you so much. We appreciate it. And let's go ahead and begin asking questions. Going to say, I see Nancy Johnston. Nancy?
To go back to the very first presentation, there were numbers showing the number of sheltered people, and I put down 2,400 in 2020 and unsheltered 600. And I wondered, is that just in Minneapolis? Is that per year? Is it? I wonder if you could clarify that a little more, Danielle.
Yeah, absolutely. So the Housing and Urban Development Federal, HUD, they decided that we were going to do one count a year, mandated nationally, and they decided that it was going to be the end of January. So you can imagine that for our community, it's tricky to get the volunteers, and also, you know, people aren't as outside in January count as maybe like a June count. So I explain all of that to say that that 600 number comes from the 2019 unsheltered point in time count. There wasn't a point in time count in 2020 because there was a lot of concern about, you know, volunteers spreading out during the middle of a pandemic. And we didn't want to encourage, you know, any sort of unsafe, so non-social distancing. So the number is a bit stale. We will be engaging in our 2021 point in time count, or 2022 point in time count, which is the end of January, this upcoming January. And so we'll have an updated number at that point. And Hennepin County is leading several community work groups to make sure that we're really coordinated on that count. The shelter number that you saw is youth, families, and single shelter. And it's that inflow and outflow throughout the full year. We just have a lot more shelter data because we know every person that's in shelter on any given day, so we can pull a lot better reports than our unsheltered point in time count, which has all of the things I told you.
So those aren't separate people, 2,400. That was the number in and out of the shelters.
So that number is the number of folks that we sheltered total.
Oh, okay. It's actual. Okay. Thank you.
Yeah, thank you.
Colleen, did you have a question?
I did. You know, there used to be a Wilder survey that was conducted, much the same time count. And is that still done?
Yep. It's not every year. I want to say it's every 3 years, but I also want to say it's every 5 years. So I'll need to look into that. But it's not a regular annual thing, and the reason is because it's extensive. I mean, the amount of coordination and the questions that they ask. You know, they're a little traumatizing when a stranger is asking you really personal questions. So there would be survey fatigue if we did it every year. And we don't want to burn people out. And we also don't want to make them feel put upon, because we give them the survey, but we don't have any services attached to it, right? And so we're asking them for all of this information. And then they're like, what are you doing for us? Which is an excellent question. So we get such great feedback from that survey, and it would be great if we could pair it with, you know, actual services at the same time. Yeah.
Thank you.
Thank you.
So could you talk a little bit about the challenges of mental health and language issues?
Oh, yes. Yes. So the challenge in mental health is persistent and real, and we are seeing more acute mental health issues both during and post-pandemic. For obvious reasons, there was lack of access to mental health services during the pandemic, and now, you know, it's just kind of and, you know, they're experiencing homelessness. So the shelters are really adept at dealing with behaviors and trying to get people connected to mental health services. I haven't spoken about them yet, but we have an amazing healthcare for the homeless team in our community. They are world class, and they have really been building out their team. So they have practitioners, they have social workers, and they have mental health workers. And so those folks are they go outside, they go out with outreach teams, they make themselves available to folks in encampments, they make themselves available to folks in shelter. It's not meeting the need. We still have folks that we, you know, need to work with the hospital because their situation is so pronounced and so dangerous to them and others that, you know, we need severe medical intervention, and that's just ongoing. But we're getting better at those services. We honestly need more, and we're seeing that again as we kind of we're not coming out of the pandemic, but as we come closer to coming out of the pandemic. So it's a work in progress. Regarding different languages, so it's an interesting question because there's like subpopulations, and we need to be better about recruiting folks that actually speak those languages to work in shelters. But it is hard to do that, specifically Somali populations. And there's a small Hispanic population, and there's one shelter that serves them very well, and they have many Spanish-speaking speakers on staff. And the shelters do have access to language lines, and we make sure that flyers and things like that are printed out in multiple different languages. So again, we could do better, but we're trying to do what we can to meet those needs.
And regarding voting registration, how does the language piece work with that? I mean, do you have access to enough services, or?
Could you repeat the question? I was blanking out for just a second.
Related to voting,
Yeah.
The issue of language, how does that get addressed?
Yeah. So there are language lines also that are available on election day to help with translation if needed. But honestly, the best, I mean, and we try to work with cities so that cities can hire election judges to serve in polling places that have a concentration of folks for whom English is not their first language. And I think there's still work to be done there. A lot of folks, you know, frequently the best solution for folks in that scenario is to bring someone with them. A voter does have the ability to bring someone with them to assist them in whatever way they want, whether that's translation or if they need help marking the ballot physically. That is the voter's right. So a lot of folks, you know, like Somali elders frequently like their kids will come with them and help them to vote. But you know, a lot of times the cities, so in Hennepin County, it's the cities that actually manage and run the polling places on election day. And those cities are tuned into the specific geographic areas which polling places really have the greatest need for voters, for election judges who speak the language.
Thanks.
I've got a question, and that is, it's fantastic that we have had this influx of money to help with this issue. How long will it last, or how will we sustain it?
That's the question. So we know how long it'll last. American Rescue Plan funding, for the most part, and it's a nuanced question, but I'm going to generalize it and say it'll go through 2024 for the most part, some 2025, some 2026. But for the most part, it's a 4 to 5 year extravaganza. So what we've done is we've tried to be as thoughtful with the funding as we could. So something I didn't even mention was capital improvements for board and lodge and shelters, board and lodge facilities and shelters. It's a really, really good use of this money because it's one time, right? And it'll make lasting impacts for years to come if we can really bring these facilities up to the level that they should be, and so that we can get ahead of whatever's coming, and we can try to have HVACs and bathrooms with no touch and just try to prevent diseases in congregate spaces. So we're trying to use the funds for one-time things like that. We're doing an encampment response, which is again going to be a 2-year limited funding stream, but we're just going to create infrastructure and coordination, and we're going to create a huge impact with that funding. And then there's funding that we just need, right? So the 24/7 and the case management, those are permanent pieces that we are going to need to figure out how to fund ongoing. Luckily, we know it's coming, so it's not like the fiscal cliff that we experienced with the CARES funding, where it's like, you got 9 months left, so we're going to be able to be very planful and be strategic in where we can use property tax and where we can increase revenue to cover certain pieces, and county reprioritizing their funding. And so we are committed to this. We are calling this case management team permanent, and so we're going to figure out how to fund them ongoing. Billing is another way to do it.
I'm just wondering about the numbers of children and the services that children that might be in the homeless or unhoused, I guess.
So our family system experienced, again, you don't hear many good things coming up from the pandemic, but with the eviction moratorium, our suspicions were confirmed that a big reason why families end up in family shelter is because they're evicted from their units, and that's the last place that they have to go. And so we saw an intense drop in families seeking shelter through the pandemic. Obviously, now we are beginning to see a slow uptick, and we're trying to be, again, getting as far upstream as we can with those prevention resources and the resources at eviction court and everything like that. So the actual numbers in families, the number of families in family shelter, I believe we have a weekly shelter report. I can pull it up. I believe it's like 35 families right now, which equates to, I think, including the kids, I think like 120 people. I can pull up the exact numbers. So it's, we have a lot of empty rooms at our people serving people shelter, which again is a great problem to have. They're there if we need them, but right now we are seeing a much lower family census than we normally do.
Thank you.
Jeannie, do you have a question?
I do. I joined a little bit late. I don't know that this was addressed. And that is, are there specific strategies for responding to encampments, identifying them as they begin and responding, before they become significantly large? I live not terribly far from Franklin Avenue, and there was a significant encampment there. And if there are strategies, what are those? Thank you.
Yes, thank you for the question. There are definitely strategies. Are we employing all of them in the way that we should be with the people we should be? No, we have a long way to go in our encampment response, which is why we're excited that we have funding in order to be thoughtful and create that. So right now, encampments, we do have a lot of services going into encampments, and the strategies are national best practices, right? Like bringing the services directly to the people, not having some sort of mandate that they must enter shelter, but really meeting them where they're at. We know a lot of our unsheltered homelessness is also kind of concentric circles with severe opioid addiction and mental health needs. And so there's a lot of other huge service needs out there that aren't just around housing and homelessness. So it needs to be a multifaceted public health response that's coordinated. And so right now we're piecing it together. There's been a lot of additional staff brought online at the city and the county to do planning. We just hired a planner who's doing an incredible job and really trying to prove this model that we can house people directly from the streets. And like you said, if we don't wait till it gets really entrenched and really bad and really dangerous, and we kind of know where people are and able to kind of follow them as it's a transient population. So we have a long way to go. Our case management team that we just brought online, they can absolutely serve people who are experiencing unsheltered homelessness. And we expect to be able to just infuse more services and coordination. So a lot more to come.
I've also heard that a sense of community is one of the characteristics of encampments, which makes a kind of intuitive sense to me. You know, no matter who you are, you need a community, and I wonder to what extent that can be a piece in some of the models that you're developing to respond to this.
Absolutely. So our stance is that people deserve housing and that it's unsafe for people to be unsheltered, and that everybody deserves dignified housing. But there is community in encampments. And part of it is serving them by addressing that, right? So learning who the leader of the encampment is and knowing what their cleanup strategies are, and really talking to them and engaging with them and saying, you deserve housing. How can we help you get there? And sometimes it is that it's a community and people don't want to leave until everybody's taken care of. So if we do have housing and services and people actually believe that they're getting taken care of, you're right, that sense of community can actually help people disperse rather than stay together.
This is so hard.
It is.
Thank you for what you do.
I've got a question for Ginny, and that is, do you keep statistics on the number of unhoused people who vote in each election?
We do not have anything like that, and I'm not sure how we could keep a statistic like that. I suppose we could manually find those voter registration forms that have descriptions on them, as opposed to like a permanent address that might be a proxy. But yeah, I don't have that we do not have that data now.
Mm-hmm. Do you have a sense that it's increasing with your efforts?
I don't know that I know enough to be able to say that. I like I said earlier, our so far our strategies really are focused on people who do have access to shelter, and we haven't been able to do much around the unhoused population.
Okay, thank you.
Mm-hmm.
Any more questions? Looks like Nancy.
Thank you. It's an overwhelming problem. And if Danielle, if you could say what is most needed, say in Minneapolis, for instance, and how individuals can help. I know that you work through a lot of community organizations. Is that something that you would recommend we do? But also, if you could have one big, besides money, what do you think is most needed?
That's a loaded question.
Yes.
So the first piece, remind me of the first piece. The first part of your question?
Gosh, I guess what, well, I think this is the last part, the, what can individuals do? I guess I wondered what you think is most important. If you could say, oh, we need more of this or that,
Got
or
it.
is it
Yeah,
everything? And also
got
as
it.
individuals, is there something that League of Voters people could do?
Well, I'll make a plug for our nonprofit partners here. So we are a major funder of shelter. We are the largest funder of shelter in Hennepin County, and the majority of the shelters fundraise up to half of their budgets, and it is hard. And so I would say, you know, if you're looking for a worthy nonprofit, look into the single adult shelters, the youth shelters, the family shelters. You know, they're always trying to make it work, and they're coming up against, you know, wage issues and trying to get good workers. And so I can't help but take the opportunity to answer your question and make a plug for our nonprofit partners. In terms of what we need for the system, I mean, it's housing. I mean, it's the type of housing we need for the and the supports that we need with the right type of people and the right type of neighborhoods with the right type of pricing. We just need a spectrum and just a wide swath of housing that's affordable for that 30% and below area medium income folks. And so we're beginning that slide I showed you of like the 10-year plan of being the first ones in on affordable housing investment. We believe that that's going to put these units online, but not fast enough, right? And so, I mean, the answer is housing. We need affordable, supportive housing.
Thank you.
Danielle, oh, sorry, go ahead, Janet.
Can I ask, when Minneapolis talks about affordable housing or more housing, is that part of the Hennepin County, or is it separate, or is it coordinated, or, you know, what, I guess, yeah, where are the two? How are the two combined?
I'm so glad you asked that. So we are very coordinated. The mayor of Minneapolis actually is one of our chairs at our executive committee, which is basically we have a community controlled process. This is a whole HUD thing where you need a community board to manage our HUD funding. And so the mayor of Minneapolis, whoever the mayor of Minneapolis is on our board, as well as the chair of the Hennepin County Commissioners. And so when our office and my boss and everybody presents to our executive committee, we're really trying to get on the same page around strategy, around language. And so we are now saying, when we're talking about affordable housing, we're talking about 30% or below area medium income. And if we don't mean that, then we say that out loud, and then we say that it's not this group, it's this group.
Danielle, when we had people on both sides of the rent control issue speaking last month, the head of the Multifamily Housing Association, Cecil Smith, was saying that one thing that is needed is increased financial support for families so that they can afford the housing. Has the county looked into that?
So, yes. Yes, but not, I think, in the same degree that you're thinking of. So it's hard to say that it is the job of the county to help all of the incomes meet whatever the rental market is dictating, right? So it's the idea of making sure that we have affordable housing for everybody. And yes, raising incomes, employment assistance, we have benefits for families, SNAP, I'm forgetting all of the acronyms, but there's significant county benefits for families, state benefits for families, medical assistance. So yes, there's a social safety welfare net to help folks get as much income as they can possibly qualify for. And then we need affordable rents based on that data, that information. If we have this many people in our city that can afford this housing, then we need to find a way to make sure that we bring that to bear. I hope that answered your question. I may have gotten this
Yeah,
so
thank you.
Okay.
Could I just ask what the area median income is now?
You know, I should have been ready for that question. Google will tell me. Here we go. Oh my goodness, that can't be right. Well, Google told me that it's, for a family of 4, it's 104,000 for a family of 4.
But don't the area median incomes change by area? Is that for our area?
Yeah, it's for Minneapolis or metropolitan area.
So what is that? The 104,000? That's the median
The
income?
area median income for a family of 4 in 2021. So if I'm talking about single adults, then it would be taking this, dividing it by 4 and doing 30%, right? So this is for a family of 4 as the median. And I'm bad at math, so don't check me on that.
104,000. That sounds high.
Well, that wasn't part of my presentation. You can blame Google if that's high.
Yeah.
Can I just ask a question that I posted online here in case you don't have time to answer it?
Oh, sorry, I wasn't looking at the chat. I was distracted by our conversation.
Okay, but is there a place that you can donate substantial goods, clothing, bedding, those kind of items for people who are experiencing homelessness? Where can one do that kind of donation?
Yep. So again, it's with our nonprofit partners. So you know, there's a list out there somewhere of all of the emergency shelters, but you know, the family, people serving people serves families. I know that they did a lot of donations. I think at one year at Christmas, they were like, no more. So that was a good year. But Salvation Army Harbor Light Center is always taking winter coat donations. They do a coat drive every year, and that's incredibly impactful for our population. They give those to street outreach teams. Simpson Shelter and Our Savior Shelter and St. Stephen's has 2 shelters, and then the Homeward Bound Shelter run by AICDC. So there's just all of these nonprofits that are just hustling and trying to make their budgets work and providing as many toiletries and you know, bedding as they can. So it's really just kind of tapping into the local nonprofits that serve the population that you're most interested in donating to, and I think just making those connections with those agencies.
Does anyone have a list of items that are needed? That would be helpful.
And again, the shelters are so good at doing inventories and being able to share what their clients need, and it's not always intuitive. You know, it's sometimes you know, job specific items, you know, like heavy duty work boots that so it's a lot of, it's always good to just ask, find an org that you like and just ask what they need. That's my best suggestion.
The public high schools have programs for homeless students, I believe, or at least some of them.
I believe, are you talking about Homework Starts with Home? Is that that?
Just students who they've identified as not being housed. In some cases, they're, couch surfing. And
I don't know as much about that program, but I think you're talking about Homework Starts with Home, and that's essentially a prevention program of, like you said, trying to identify students that need that extra attention, need that extra support, and making sure that they kind of stay out of any sort of homeless response services, and that they kind of get that from the school.
okay.
I'm probably not describing that program as well as I should. I was well over the single adults before I moved into this position, so I'm learning the families and youth system as best I can, as fast as I can.
Who are your nonprofit partners? I'm thinking of Beacon and Minnesota Coalition for the Homeless. And of course, those organizations can always use the money that the people on this call have. But who else is considered a partner?
We just have a wide, from our housing providers to our shelter providers to our street outreach providers, there's actually a really large swath of nonprofit organizations that are in this work. I believe that there is a comprehensive list, as I know there is, because we have to have one because HUD tells us to. And so I'm sure that there's a list that can be generated of different nonprofits. But if you search, single adult shelters in Hennepin County or youth shelters in Minneapolis, there's a ton that you can find. So it's really just kind of zeroing in on, there's just so many nonprofits, I can't even list them. And then there's the housing support and the rapid rehousing and the community-based programs, and then the suburban food shelves. And so it's really just too many to list at this point. It's really just, again, doing the research to kind of figure out what you do want to donate to or contribute to. And I can help. I can be a resource if you want to reach out and have specific questions. I'm happy to correspond. Of just giving a list. I can't tell you where to donate. I can just give lists of organizations.
All right, any more questions? So I just want to close and thank you again, Daniel Werder and Ginny Jelms, for being with us tonight. We really appreciate it. I learned a lot, and we are so glad to have you. Thank you.
Thank you.
Thanks.
Thanks for having us.
Thanks. Good night, everyone.
Good night.